Hi, I'm Dr. Thad, and on this short video today, I want to share with you information about the growing epidemic of autoimmune conditions in this country. But first of all, I should explain what in the world a chiropractor is doing to talk about this in the first place. While the first several years of my practice, I focused on traditional chiropractic care in an effort to help a population of people I saw who weren't getting help elsewhere, those suffering from chronic conditions. I devoted a lot of time and study into functional medicine and functional neurology with an emphasis recently on functional immunology, because I see that underlying a lot of people's chronic health conditions are issues with autoimmunity. And in order to understand an alternative approach to helping people with autoimmune conditions like rheumatoid arthritis, multiple sclerosis, rheumatoid arthritis, psoriatic arthritis, Sjogren's, lupus, juvenile diabetes, you'll see that there are nearly 100 different named autoimmune conditions, but they really boil down to one problem, or they could be almost the same condition. The only difference is which particular tissue, organ, or enzyme is being attacked is how we name the condition. But the underlying triggers and the underlying mechanisms within your immune system are pretty much the same in everyone. The only difference is in how it manifests itself in the individual patient. To understand how we work with people suffering from autoimmune conditions, first let me show you how how your immune system is supposed to work. Immune system is designed to help protect us from foreign invaders or antigens, things like bacteria, parasites, yeast, molds, which is a growing problem and really can cause some serious havoc within our immune system. But those are the things we traditionally think of, viruses, but can also include things like foods. So sensitivities to foods that we eat every day. It's a possibility that they're causing inflammation in the body and they're causing our immune system to be activated. In fact, there's recent research that suggests that foods cooked at too high of a temperature changes the protein structure and actually can initiate an immune-mediated antigen response to that protein. Obviously, toxins. And this is a big one today, and this is the reason that we've seen autoimmune condition rates triple over the last several decades. Obviously, we can't totally shield ourselves from a toxic environment, but we can do things to drastically minimize our exposure, as well as do things to help support our body's ability to detoxify itself. Things like heavy metals, in particular, mercury. If you have these things in your body, there are ways to get rid of them. But what these collectively represent are those invaders or antigens. So we call these antigens. There's a special type of white blood cell that recognizes those antigens. And when it does, it makes something called an antigen presenting cell. The antigen presenting cell is like you or I if we were to spot somebody on America's Most Wanted list, a fugitive from the law. We'd get on our cell phone, right, and we'd call out to 911 most likely. The 911 control center are your T helper cells, and your immune system communicates through the use of chemical messaging messenger signals. And in this case, the signal being sent is a cytokine called interleukin-1. So the antigen presenting cell calls out to the T helper cell, or 911, hey, there's something going on here. So your T helper cell calls out to the local police station or your T cells, and they get on the phone to the FBI, your B cells. T cells are the first line of defense against infection or attack from foreign invaders. They attack things, destroy them, and clean up afterwards. This is also referred to our Th17 system, where the B cells are responsible for making antibodies. They tag things for attack and destruction. This is our Th2 system. Now there's different types of cytokines that signal to Th1 and different types of cytokines that signal to Th2. Normally, after the antigen is removed, this process should calm itself down. When we have repeated or continuous exposure to these things, this inflammatory process, because cytokines are inflammatory, is allowed to burn out of control. And if things really get out of control, a third pathway of the immune system recently discovered is activated, something called your Th17 system. And one of the chemical signatures or cytokines, again, that is inflammatory, involved in this is something called interleukin-17. Interleukin-17's been showed to stimulate as many as 12 different pro-inflammatory mediators. So this really sets things ablaze, and we see a lot of tissue damage and destruction. And this is allowed to burn out of control, and this is what we see happening with an autoimmune condition. Now, traditional medical management involves coming in with powerful immune suppressing drugs like corticosteroids to decrease inflammation, and other immunosuppressive drugs that can, while they're totally squashing everything out, we need our immune system. It's there to protect us, and if we totally squash our immune system, we leave ourselves susceptible to certain types of cancers and other lethal infections. And it doesn't make any sense to go in there trying to put the fire out unless we remove the triggers or what set the fire going in the first place. And that's where our approach differs. We need to identify those triggers and remove those through the appropriate testing. And we need to look specifically at your immune system on how we can help dampen the Th17 system, because there's certain natural things that have been showed to do this to help put the fire out. But we also want to balance and modulate the immune system, because we need a strong immune system. We don't want it too strong, and we don't want it attacking itself. So using specific testing and natural substances, we can help bring order into the immune system. We don't want to just put out the fire, we want to rebuild the house. And the only way to do that is to identify, again, what the triggers are and what exactly is going on with your immune system, so that we can address it through dietary modifications, sometimes through lifestyle, stress reduction, quality sleep, quality exercise, and then specific supplementation meant to help, again, put out the fire and support and modulate a healthy immune system. And it really doesn't matter what we call that autoimmune condition. This is what's important here, and this is what we need to address. And in order to find out whether or not this approach may be appropriate for you, or you're interested in learning more about our functional support for autoimmune conditions and other chronic health problems, I invite you to please call our office to set up a discovery visit to find out whether or not we may be the answer that you've been looking for. So again, please call our office at 814-238-0232 to set up a time where we can sit down and help find out whether or not we can help you get your life back.